Welcome to It's Not Me,
It's My Personality.
where we dive deep into the mental health topics and nursing care. I'm Shanice,
And I'm Avery.
and today we're exploring the nursing process for personality disorders.
Personality disorders can be challenging to manage, but with the right approach, nurses can make a significant impact. So let's break down step by step.
Alright, so the first step in the nursing process is assessment. This involves gathering detailed information about the patient's mental, emotional, and social well-being. Here's what we look for as nurses. In patient history, we ask about childhood experiences, family background, trauma, and medical history. In their behavioral observations, we observe mood swings, impulsivity, emotional regulation issues, and self-harm tendencies. For cognitive assessment, we ask the patient how they perceive themselves and their ability to reason. With their interpersonal relationships, we see if they show signs of dependency, avoidance, or manipulation. With risk management, we double check everything if they are having any suicidal ideation, self-harm risk, substance abuse, or potential harm to others. And lastly, in physical assessment, we check the signs of self-harm, malnutrition, and or medication side effects.
For our second step is going to be nursing diagnosis, identifying the problem. After gathering data, nurses must identify the primary concerns. Some common nursing diagnoses include ineffective coping due to emotional dysregulation, risk for self-harm or suicide due to impulsivity, disturbed thought process from distorted self-perception, impaired social interaction due to avoidance or distrust, risk for violence, self-directed or towards others due to poor impulse control.
For the third step in our nursing process, it's the planning part, or where we set the goals. So once we've identified the issues, we set goals for the treatment. These are actually tailored to the patient's needs and may include enhancing coping skills and emotional regulation, reducing self-harm or suicidal behaviors, improving self-esteem and identity, encouraging independence and decision-making skills, promoting healthy interpersonal relationships. It's also important that we know that people with personality disorders require a sense of control over what is happening to them, giving them realistic choices that may enhance their adherence to their own treatment. It is also important to plan individual patient treatment within the context of their family.
The fourth one is implementation, nursing interventions. Now let's talk about how nurses help patients achieve these goals. Interventions include building a therapeutic relationship, establishing trust and settling clear boundaries, creating a safe environment, preventing self-harm and reducing triggers, encouraging therapy, supporting participation in CBT or NDPT, and medication and management. Teaching coping skills as stress management, journaling, and self-awareness techniques. Promoting structured activities, routine-based care to provide stability, and educating family and support systems, helping with them with understanding the disorder and prevent enabling behaviors.
The fifth part of the nursing process is the evaluation. So this is where we measure their progress. So the final step is the evaluation, where we assess how well the interventions that we have planned are working in the patient's treatment. Nurses actually track the decrease in self-harm and suicidal thoughts, improved coping mechanisms, enhanced social and interpersonal skills, increased independence and confidence, and adherence to therapy and medication.
Now we have covered the nursing process. Let's discuss treatment options. These include pharmacological and non-pharmacological approaches. Medications can be antidepressants, SSRIs. They help manage mood, instability, and depression.
Mood stabilizers and anticonvulsants. It actually helps reduce impulsivity and aggression. Atypical antipsychotics addresses anxiety and emotional dysregulation.
Benzodiazepines, you are going to be used cautiously. They treat anxiety but may pose risk for dependency.
And the next one for pharmacological or for the approaches would be psychotherapy. This is actually the first line of treatment. So some examples of psychotherapy is DBT or dialectical behavior therapy, which is highly effective for people with borderline personality disorder or BPD.
Cognitive behavioral therapy or CBT helps patients with avoidant obsessive compulsive and dependent personality disorders.
Mentalization-based therapy or MBT. This actually teaches emotional awareness and reduces impulsivity.
The schema therapy addresses deeply ingrained negative beliefs.
And psychodynamic therapy, which explores unconscious conflicts and childhood influences.
Additional types of therapy can be group therapy, encourage social skill building and emotional support. Family therapy educates loved ones on setting boundaries and supporting recovery.
And lifestyle modifications for the last bit. And this actually helps with stress management, structured routines, and avoiding toxic relationships.
Managing personality disorder is a complex and ongoing process. Psychotherapy is most effective treatment. Medications help but do not cure personality disorders. Nurses play a vital role in the assessment, intervention, and patient education. Support systems like family group therapies improve long-term outcomes, and building trust and setting boundaries are key to effective nursing care.
So that's a wrap for today's episode of It's Not Me,
It's My Personality as our final episode.
If you found this discussion helpful, don't forget to subscribe and share this episode. So until next time, guys, take care and keep learning.
Yeah, bye guys.
Bye.